Okay, my name is Mcclelland. I'm a senior lecturer in optometry at Ulster University, and I just want to talk to you today about the development of a teaching tool that we have used to enhance the students' differential diagnostic skills. So just some background, so I'm involved in teaching undergraduate and postgraduate students ocular pharmacology and therapeutics, and this involves clinical decision making based on signs and symptoms that patients present with. So we've developed a tool to try and refine the students' skills. This is both for revision and teaching purposes. So the funding for this project was obtained from ADDL, which is Access Digital and Distributed Learning at Ulster, and I worked closely with Richard Beggs and Niall McShane, who provided the technical design for the project, and this was also developed in collaboration with some other optometry staff. Okay, so this is basically an online simulation or game that allows our students to practice their diagnostic skills. So the conditions are generated from a pool of 14 different eye conditions that typically present as a red eye. So these are based on the types of conditions that present to optometrists in practice very regularly, but things that could be quite easily misdiagnosed or confused by students. So the presenting signs and symptoms have been written specifically so that they relate to certain conditions. So the patients are generated from a random pool. Medical notes, level of vision, and a range of different ocular measurements are generated to provide a variety of information for each condition. So the presenting signs and symptoms and all the information have been taken directly from the College of Optometrists Clinical Management Guidelines. So this is a live, up-to-date evidence base for a range of different conditions. So the user can choose which optometric test to apply. So these results are based on the type of condition. So for example, people with acute glaucoma will present with a very high eye pressure, or patients with quite a severe inflammatory reaction will have quite reduced vision. So the signs and symptoms and measurements tie in with the clinical management guidelines. So this is just an example. So a patient, someone or a student or someone chooses a patient from a waiting room, and they're presented with a name and age, if they're male or female, and then a list of signs or symptoms. And then the next step is they can choose to look at some ocular measurements. So they can have a look at the front of the person's eye. So we have a bank of images to allow them to see what they would see if it was a real patient. These are all real clinical images. They can take a measurement of the patient's vision, and this is a dynamic system that allows the student or the user to see which part of the eye chart is clear and which is blurred. There's lots of other measurements they can take. So they can measure eye pressure. They can apply a stain or a dye to the front of the eye to see if there's any damage to the surface of the eye. So there's a list of different techniques that they can choose to do. And then the user is asked to select a condition from about 14 different options, and feedback is given then on whether it's correct or incorrect. And then this provides the student with a direct link to the College of Optometrists Clinical Management Guidelines for that particular condition. So these are up-to-date live guidelines that they will be linked to. So the development of this project was informed by a focus group with a small number of students who initially helped to refine the design. So these were postgraduate students who were involved with an independent prescribing program. So after that, we decided we would trial the project with 20 undergraduate students and 10 qualified optometrists or members of staff. So we gave them a demonstration of how it works, followed by a questionnaire to investigate the application's ease of use, difficulty rating, how interactive it was, the quality of the images, and the educational value. So in general, it was all very positive. So 100% of respondents agreed or strongly agreed that the tool was easy to use. Everyone thought that it was very interactive. The majority agreed that it was challenging, more the students than the staff, which is probably a good thing. And the majority agreed that the image quality was good. And that's one area really that probably needs to be slightly looked at, in that we need to increase the bank of images that are available. So the majority of people agreed that the tool was ready to use for teaching or assessment, And all the students felt that they'd learnt something from the programme, not so many staff, obviously, which is probably a good thing. And some additional feedback related to just the overall design. Some people wanted a little more guidance on how to use it. Some people didn't like the background music. Just a few small things that can quite easily be technically adjusted. And of course, the main comment was that, of course, they wanted a wider range of conditions. So the current limitation to this is that it needs to be downloaded, so it's not very user-friendly at the minute. It's not a web-based platform. Benefits for students are that it provides an introduction to online learning, which is important for lifelong learning for optometrists in practice. Students are given immediate feedback. It helps to improve their diagnostic skills. It allows them some revision practice in a safe environment. And it also sort of directs them towards the use of the clinical management guidelines, which we do try to encourage them to use sort of official guidance and policies where they can. And it does make it ideal for a fully online programme. So, just in conclusion, there is an increase in use of digital technology across teaching, and particularly in the use of distance learning programmes. So I look after a fully online postgraduate optometry course for students wishing to increase their scope of practice and become independent prescribers. So it's been quite a nice tool to use for that. So in the past 10 years, there's been an increase in demand for further training for qualified optometrists, just to allow them to increase their scope of practice, and it's possible that this may have potential in this area. I'm not sure if there's anything else. Let's see. Yeah, so the future plan for this is that I have applied for sort of interdisciplinary PhD funding along with colleagues from the School of Computing to try and develop a bigger and more user-friendly web-based platform that will allow a wider number of conditions to be included and hopefully a more sustainable long-term project to be developed. Thank you. Sorry, it was very fast there. Sorry.